Next.
Hi, good evening, Council. My name is Larsen Ross. I am also here with the Democratic Socialists of America, urging you to pass this resolution in support of Medicare for All, Improved Medicare for All specifically. I'm sure all of you are aware of just how broken our system is from like a statistical, numerical, and cost perspective. But something that doesn't often get across in these discussions is how disastrous the current system can be when we, especially for workers' rights, when we allow employers to be able to control whether or not their workers are able to get care. Over the summer, I was working in a warehouse and there was a pretty grievous workplace accident where 4 people were crushed nearly to death by a pallet falling 30 feet from the 3rd shelf of racking. It was over 600 pounds and, falling that fast from that high up, the actual impact force is a lot higher. I had to watch my coworkers nearly bleed out on the ground from head and back and neck injuries. One woman in that circumstance is probably never going to be able to work again. She has 4 fractured vertebrae, and our employer at the time said that they would be willing to not only have the insurance that they were already on through their job cover it, but actually step up and pay for all of their medical care, and made that promise to them. And they broke that promise. They straight up denied these workers their care when the insurance premiums through their employer were too high, and the employer said that they would come out and actively pay for it. They just decided that the cost is too much. And this is a billion-dollar company, multiple billions of dollars. And they simply decided, it's not worth our time to actually protect our workers, to help those who've given so much to this company, people who'd worked there for years. Instead, we're left in various states of disability. One woman who had a pretty nasty head injury from this incident has intermittent memory loss. Is going to need therapy for the rest of her life in order to deal with this, let alone the people who need physical therapy from these injuries, some of whom are not able to work. And this is the kind of, after effects of having a healthcare system where your employer is in charge of whether or not you get care. If, we actually have a system that's rational and compassionate, like most of the rest of the world has, you don't have to worry about whether your boss is going to decide this day, that they care, and this day that they don't, as to whether or not you're going to be able to afford your medical care. Instead, you'll just have it taken care of, and you don't have to rely on somebody who may be miles and miles and miles away from you, fancy office, doesn't see the realities of your day-to-day life, to decide whether or not you get to eat and your family gets to eat. So thank you.
Thank you. Next.